everyone, my name is Harpreet Kaur and this is my first YouTube video and I make that on the topic named developmental delays. So I choose the topic speech and language under it because I think that this is the necessary topic that everyone needs to know, whether it's children or parents, so that they can detect the problem and they can fix it on the time. And I have done a lot of research on this topic so that I can explain the main causes, treatments, and the warning sign of this problem. And by doing the research, I have got that what is the developmental delay. So first, I need to explain it because it refers to a child who has not gained the skills of development that are expected from him or her. So basically, a developmental delay mainly is a kind of delay in children's learning that can be of many kinds, like in the area of speech, language, vision, and cognitive. So I have choose speech and language because I have observed that there are many children who face this problem while giving the speech and learning the language. So first, speech in speech delay refers to a child who is not able to use words or other form of communication at the expected age. So they feel a lack of communication and they do not know how to give a proper speech. On the other hand, language delays include understanding and putting words together, and children are not able to do that because they feel difficulty in it. So mainly we need to know the main causes of it and how we can treat that and how we can observe or detect that what are the warning signs of it. Now we will start with the main causes of the speech and language delays. So the first is an oral impairment. So in this problem, children has a problem with the tongue or palate, that is the roof of the mouth. So in this problem, children don't feel the flexible tongue movements and they feel the difficulty to sing a particular words. The second is a short frenulum, that is a kind of fold beneath the tongue that limits the movement of tongue. So like they can't say the many words in hurry, they can't make a sentences, they feel kind of difficulty in that. The third problem is mainly the hearing problem, that is directly or indirectly linked to the speech, because when children children don't understand that what we are asking to them because of hearing problem, so we can't expect from them that how they will respond because they don't understand the question. And moving further is the ear infection, especially chronic infections. So it can happen before or after the birth because of malnutrition or not getting the uh, um, proper food while in during the pregnancy of mother or after the childbirth. So I think these are the main causes of this problem. So, and in this world now there are many treatments available so that parents can easily treat their children if they know the main causes of it. So first we can start with the speech therapy that helps a child to make all speech sounds and combine words, so they feel and they can make easily sentences and make words and they feel relaxed, because in the speech therapy they are given in the speech therapy educators give them proper care and appreciate them when they make sentences. The second is a teach sign language. We can do that via electronic devices that help them to communicate well, like using mobile phone, computers. We can tell them how they can make us understand what they are feeling. And the third main point, they can practice at home with their parents, with their mother, father, so that what they are feeling and what kind of difficulties they are facing, so that parents can understand and help them. And the fourth point that I think is the major one is a child care. So Parents need to spend more time with their children to understand them and teach them. By doing that, children feel confident and they share their all difficulties with their parents, that what they are feeling, what kind of difficulties they are feeling. So in this way their bond becomes stronger with their parents, and there are less chances that they get these kind of delays in their growth. So now we are moving to the warning signs. So warning signs. With the help of warning sign, parents can easily detect that what is the main problem and how it is started. So if your child is not say first word by the age of 15 months, then definitely there is a problem in the speech and the language. Maybe children is facing a problem by doing a movement of their tongue. So mainly children started saying word by the age of 1 year, but if a child is 15 months old and not started saying any word, then we need to seek the attention of a doctor. Secondly, they have a problem following the direction by the age of 2 years. Even if it's if it's in their house, like they don't know where is the where to go, where is the washroom, and which is their main room, and how to go left or right. So they face this kind of problem, maybe because of hearing problem or any kind of ear infection. The third thing is speech, that strangers do not understand when child is 3 years old. By the age of 3 years, child are well developed and started to say some sentences that their parents understand. But when they got to know and they go to any stranger, but they don't understand, because basically child family started to know their child very well, and even without saying any word, they know how what a child want and what they want to say. But when they met to the stranger, they don't understand because they don't know the child. And the fourth one is the problem using right word in the sentences at the age of 4 years. So if child is facing the problem making the sentences by using correct word, then we need to worry about it and help them to get a proper treatment. So I think these are the main points in the speech and language delays, that how what are the causes and how we can treat that and how we can detect that. And I have done research on this topic from various sites, and I have put it here in the reference list. So if anyone needs more knowledge about this topic, we can search on these topics. And I would like to thank you all of you for giving your time to watch this video, and I hope you like it. Thank you so much.